Still on Signature TV, New Dawn, and still discussing some of the unsung heroes in the human body. Talking about the kidneys. We have seen rising cases of kidney failures, kidney stones here and there. And then we are here to discuss this issue and unpack some of the complications that come with kidney diseases. Joining us in the studio right now is Dr. Annie Eze Ifoma Hope. Dr. Hope is a senior registrar in nephrology with ESUT, that will be Enugu State University Teaching Hospital, Enugu. Dr. Ifoma, thank you so much for joining us.
It's a pleasure to be here.
And I love the color.
Thank you.
You look amazing.
You just brightened up our studio.
Thank you.
You're welcome, doctor. So, very quickly, someone out there wants to know, what exactly is a kidney? Because we've seen some very viral, funny videos where you ask someone, what is your kidney? They'll tell you the kidney is that, very funny questions. You find out most people don't know what kidneys are. So briefly, what are kidneys?
Okay. The kidneys are a paired organ. Paired means that there are two in the abdomen. So they have a gamut of functions. They have many functions that they perform in the human body. One of the functions is excretion of waste products. Most of the drugs that we take in are excreted via the kidney. Most of the things are excreted via the kidney in the urine.
Sorry to cut your train of thought. What do you mean by excretion?
Removal of waste products.
Okay.
So the kidney is also in charge of fluid balance in the body. The fluid content of your body, when to remove some in the urine, when to retain some, is the kidney that performs that function. The kidney also balances the pH of the body. pH is whether you're checking if the fluid in the body is acidic or alkaline, is the function of the kidney to balance it up. The kidney also performs important functions when it comes to blood production, the production of red blood cells. They produce an important hormone called erythropoietin that helps in production of red blood cells.
Okay, thank you very much, doctor. But what are the most common kidney conditions that we have?
The most common kidney conditions, there are a lot of them.
Okay.
Well, a lot of them include kidney stones.
Yes.
We have pyelonephritis, that's inflammation of the kidney and the ureter. Then the organ of them all, chronic kidney disease, what we see on social media as kidney failure. Yes. So.
Okay, what are the major causes of these things?
You mean the chronic kidney failure? Yes. Okay. So the kidney failure, like we call it chronic kidney disease. Chronic means it has passed at least up to 3 months. There's what we call the acute kidney failure. Less than 3 weeks. It's just acute, you manage it and it goes. But the one we see on social media that kills people a lot is what we call the chronic kidney disease that may progress to the end-stage renal failure. That's what we call the renal failure. So the common causes worldwide, the most common causes worldwide is diabetes. Yes, diabetes. However, in our environment, because of the peculiarities of our environment, we are prone to infections and the rest of it. The commonest in our environment is what we call the chronic glomerulonephritis. It's usually from a past history of acute glomerulonephritis, or which can result from maybe sore throat in the past that wasn't treated properly.
Sore throat?
Yes.
From the throat.
From the
through
throat.
the kidneys.
Yes.
Through the blood.
Yes. So that sore throat in the past that maybe it went after 2 weeks, wasn't treated properly, can affect you years later, either by affecting your heart or by affecting your kidneys.
Sorry, please. You really need to explain this because sore throat. When you think about things like kidney and the heart and all of that, you would not think to say sore throat can be one of the reasons why. Can you please just expatiate on more how sore throat can cause such?
Okay. So the sore throat is either sore throat or skin infection. There's what we call the skin infection that is caused by streptococcus, or the sore throat that is caused by streptococcus, which is the commonest cause of sore throat.
Yes.
So when somebody has sore throats, usually in the younger age group, teens, childhood and all, and it wasn't treated properly. Now those streptococcus, they have some proteins that remain when it's not properly treated. Now the body starts fighting. So these things, they can also go and deposit, like when antibodies are things that fight infections. So when they match with these proteins, they can go and deposit in the kidney. Now the body now senses it as an foreign antigen and starts attacking the kidneys.
Rather than the antigen.
Rather than, exactly. So that's what we call, is more of an autoimmune, the body fighting against things that's perceived it's its own self. Do you get? So that's one of the mechanisms of, but it comes, the sequelae of the chronic glomerular comes years later. And the fact that if you ask the person, have you had a history of sore throat or a skin infection, the person will say no, because if the person didn't really, exactly, yes. So, but in our environment, it's quite on the high side, especially in the younger age group.
Yes, I was getting to that, Dr. Anieze, because you have a lot of young people present in hospitals and they are diagnosed of kidney diseases, kidney issues. Is it just about the throat issue, or there are other predisposing factors that make young people, most especially, come down with kidney diseases?
There are other predisposing factors.
Okay, please, let's
One of them is a family history of renal failure.
So it's hereditary?
Some are hereditary, especially what we call the autosomal dominant polycystic kidney disease.
Break it down.
Autosomal dominant polycystic kidney disease.
What does it mean?
Okay. It means that the kidneys develop cysts are fluid-like sacs on the kidneys. The kidney is supposed to be smooth outline, but then it now develops sacs on it that contains fluid. Now, this is a genetic problem. It can be passed down from mother to child, from father to child, and it can go through the generations. Another one that can affect younger people is what we call this chronic glomerulonephritis. Another one is what we call the autoimmune causes of chronic kidney disease. The autoimmune causes means that, like I explained, the body antigens fighting against the body itself, recognizing it as foreign. Example of those is what we call the systemic lupus erythematosus. It's a multi-systemic thing that can affect almost all the organs. Then there are other connective tissue diseases that can affect the kidneys. Then in younger age group, it is in our environment now, HIV is also a common cause of kidney disease in the younger people. Hepatitis too has been found to cause kidney disease. Some other
let me cut your train of thoughts, please, for a minute. You said hepatitis.
Yes.
And we know hepatitis has to do with the liver.
Yes.
So you're saying that infection of the liver can actually have a direct impact on the kidneys.
Viral hepatitis.
Could you take us through that physiology? How does it work?
So viral hepatitis, especially hepatitis B and C. Yeah, we know that the primary place it affects is the kidney. It loves the kidney. So it's a hepatic virus, sort of.
Really?
Yeah, the liver,
Okay,
I meant to say. The liver. So, but it can also affect the kidney. When it affects the kidney, those people can also come down with chronic kidney disease.
Wow.
Quick question. What are the symptoms, especially for the early stages?
Of chronic kidney disease. So one of the symptoms, most times, that is the problem. Most times it may be asymptomatic at the early stages. So for you to start having symptoms, it must have progressed to some reasonable extent. Say stage 3 and above.
How many stages do we have?
There are 5 stages.
Okay.
So the stages is based on the glomerular filtration rate. That's the rate at which your kidney is able to remove the waste products. Exactly. So that's what we used to grade it. So as at stage 1, 2, the person may not really have symptoms per se. It's from stage 3, people now start developing obvious symptoms, which can include leg swelling, facial puffiness.
Yes.
They can also have increased urination at night. you notice that during the night you wake up more than 4 times, and your usual is 2 times or once, and it has increased. Not like you take a lot of water in the night. It could be a sign to kidney disease. Then foaming of the urine. Your urine is abnormally foaming. Frothy. We call it frothiness of the urine. Could be a sign that maybe there's protein in the urine. And when there's protein, it means something is leaking. The main filtration barrier in the kidney means that protein is not supposed to pass. At least the quantity that is enough to cause that frothiness isn't supposed to pass through. But when you're having frothiness of the urine, it means that something is obviously came from the filtration barrier.
Is there an age group for this?
No, it can affect any age group. Just like diabetes can cause this protein leak. That's one of the features, the frothiness of urine. There are a lot of things that can also, sometimes hepatitis B can also give you this picture, the nephrotic syndrome type of chronic kidney disease. So they usually have a lot of protein in the urine.
All right, doctor, you've mentioned a lot of causes or things that could predispose someone to kidney disease. You've mentioned comorbidities, where it has to do with HIV rather, or hepatitis.
Hypertension too.
Hypertension. You've mentioned heredity, genetics. You've also mentioned autoimmune reasons or causes. Now, are there other external forces that could actually predispose someone? Maybe from on top of my head, I'm thinking maybe alcohol, drugs, and please, what are the mechanisms through which these things actually cause kidney disease?
So more of the factors, at least in our environment, is use of herbal concussion. Yeah.
Is there research backing this?
Yes. A lot of the herbal concussions that we use around here, they are not really regulated. We don't really know the context. We just get roots and herbs. And most of those things have been found to be nephrotoxic, toxic to the kidney. Then some of the drugs that are even
like supplements?
Approved, like supplements, all these Chinese supplements. Then some of the drugs that are approved, especially all this pain relief, the NSAIDs, the ibuprofen, the diclofenac, when you abuse it excessively, it also causes some kidney diseases. Then the use of all these bleaching creams. They've baptized now to organic creams and the rest of it. Yes, it was also found to be nephrotoxic. Some of those things inside, mercury, hydroquinone, they are toxic to the kidneys. So
what about alcohol?
Yeah, alcohol, yes, but alcohol has not been found to have a direct impact. It's still under study. But yes and no. Yes, because yes, there has been linked to it, but it's not actually direct. So most studies are being done on the effect of alcohol on the kidney, but not yet established as it is.
Is there a relationship between high blood pressure and the kidney?
Exactly. So the kidney is the primary place for regulation of blood pressure. Yes. So chronic kidney disease can cause hypertension in someone that doesn't have hypertension, and hypertension can cause chronic kidney disease.
Both ways.
Both ways. Yes, but in our environment, most people that have chronic kidney disease, they have high blood pressure as a result of the chronic kidney disease. However, there are people that has been hypertensive for a while, maybe due to poor control, they are not taking their medication. One of the complications of hypertension is still the chronic kidney disease.
All right, so let's talk diagnosis, testing. What are the tests, the basic tests that someone can actually run that will point towards maybe an impending kidney problem?
Okay. The person should not run the test on its own. The person should come to a hospital so that those tests will be conducted. But one of the very basic is urinalysis. Just taking your urine and doing a dipstick could be a pointer. You're looking out for proteins in that urine.
Yeah, you mentioned proteins.
Is one of the early markers, especially in diabetic people and other conditions. The presence of protein in quantities that are not meant to be in the urine. It could raise your suspicion something is going on in the kidney. Then you can do microscopy. You can pass the urine under a microscope. Presence of blood too can be a pointer. There's what we call the microscopic hematuria.
Physical blood or under the microscope?
Even the physical and blood. The microscopic is that you can't see with your eyes, but when you put it under the microscope, you can see red blood cells and maybe the cast of red blood cells. So it could be a pointer that something is going on with the kidney. Then there's what we call the kidney function test, in quote, the serum, urea, electrolytes, urea, and creatinine. The creatinine is one of the things that kidneys excrete. So when we check the blood and we see a build-up of that creatinine is rising, it means that the kidney is not doing what it's meant to do. There's a problem back there in the kidney. So we go ahead and do other tests. If you come to the hospital, we may ask for ultrasound. The size of the kidney could be a pointer that something is wrong. Typically, in people that have chronic kidney disease, the size is usually smaller than the normal, especially in the towards the late stage.
Yes.
So we can also do a kidney biopsy. We take something from the kidney and then pass it under a microscope, stain, and we can now make the diagnosis of the cause of the kidney, the chronic kidney disease.
How often should I go for tests?
Well, you can go for your test yearly.
Once a year?
Once a year. If you have no risk factors, you're not diabetic, you're not hypertensive. Sorry. There's another important cause of kidney problem I forgot to say. Obstructive uropathy. Example is this prostate that we just finished talking about.
Yes.
So when there's an obstruction of urine from any cause, enlarged prostate, tumor in the bladder, stones, it could cause chronic kidney disease. So if the person has no obvious predisposing factors, once a year it could be fine. But then if there are predisposing factors, you're diabetic, you're hypertensive, you have HIV and the rest, you could be screened more often depending on your regular checkups at the hospital.
Okay. Speaking of kidney stones, tell us more about kidney stones. Are the stones formed in the kidney? How do they result?
Okay, so kidneys, like I mentioned, the kidneys, they maintain the body pH.
Yes.
So there are some situations where the pH of the body or around that kidney is abnormal, either more acidic or more alkaline. So that state is what makes the stones form. If it's more acidic stones will form. If they're alkaline stones will form. And then there are cases of obstruction, like we mentioned, this prostate issues now. When urine is not passing as it should, most of those crystals, normal crystals that the urine produce, can start crystallizing in those kidneys and the ureter, and then can cause kidney stones.
All right, Dr. Anikwe.
Anieze,
I beg your pardon. Before I get to my main question, what is the normal pH?
The normal pH of urine per se is between 4.5 to 8.
Okay.
So that's the normal. If it's lower or higher, it could predispose to certain stones forming right there in the kidney.
That's fine. All right. So there's this group. They go around with a certain apparatus, and they'll get to you. They'll tie like an electrode-looking stuff on your arm, and then they will check the apparatus and say, "Oh, you have this. Oh, you have sugar. Oh, you have kidney issues." Please, what are your thoughts?
My thoughts are they are scam. There's no
plain
one
and simple.
Simple, they are scam because there's no one thing that will detect sugar.
And every of those.
Nah, they're just scamming people of their hard-earned money. We've encountered some of those, and by the time they're presenting, it's already late. Because those people must have drained them. It's not cheap now. The prices of those things, they're not cheap. So most people must have drained them before they eventually present to the hospital. And the problem we are encountering is late presentation.
Sure.
They must have tried herbal, tried this group of persons, tried the church, and then when it fails, they now come to hospital and expect you to do magic. So that's the issue.
Okay, so coming up from this now, can you discuss the treatment options available with the chronic kidney disease?
So the treatment options we have, it depends on the stage of the disease. So beyond or before you get to stages 3, there's an option of conservative management. Conservative means that we don't do anything active. We look at the things that we think are predisposing you to this kidney, and we handle it. If you're diabetic and you have poor control, we control your blood glucose, we control your blood sugar, we treat infections like UTI. If you have obstruction, we relieve it. If you have a large prostate, we send you to the urologist to go and maybe do prostatectomy or something, so that there will be a free passage and allow you. Then it depends, as the stages progress, that we have what we call the renal replacement therapy. The renal replacement therapy includes what we call the dialysis. And then the kidney transplant. Dialysis could be either hemodialysis or peritoneal dialysis or other forms of dialysis, then the kidney transplant. So these are the treatment options that we have.
How affordable are these options?
I
like that side.
The truth is, kidney problem can render even the greatest millionaire bankrupt. It's bad. At least the dialysis, what we call maintenance hemodialysis, there are people that have acute kidney injury and they have dialysis 1 or 2 times, their kidney picks up and they are fine. But once we are already in chronic end stage, the person has to be on maintenance hemodialysis, which is 3 times in a week. A session currently costs about 50-something thousand. So you're talking of say roughly, because it's not just the dialysis you're paying for, you may need blood transfusion, there are other drugs that you'll be given, roughly 200,000 a week for the dialysis. So, and you're supposed to continue for life until you can be able to afford renal transplants. Then talking of renal transplants, it's not mean feat. It's quite expensive. As at before this increase in prices of things, I think at Carnegie was about 15 to 20 million naira.
And then getting a donor, shouldn't that be the major issue?
So that even if you get a donor,
is it a match?
Is it compatible? Yes. Okay, now, so of course, we know the prostate has to do with the male, but then the kidney affects everybody, but the male and the female. How about pregnant women? How does this affect them?
Pregnancy, yes, is also one of the predisposing factors, because by the time someone is pregnant, but most times those pregnancy induced can be reversed once the person gives birth, but some do not reverse. So something like preeclampsia, because once the person starts having preeclampsia, there is some form of affectation of the kidney with elevated blood pressure and all. Some people may, after pregnancy, they may return back to normal. Some people from that pregnancy, they're already entering end stage. There's also, because normal pregnancy, typical normal pregnancy, the effect of progesterone on those ureters makes it to dilate. So most of them have hydronephrosis, pregnancy-induced hydronephrosis. Hydronephrosis means that the conduit in which the urine passes is a bit dilated. So, and when we define CKD, we define it as a structural or functional. So the person may not have, after pregnancy, the person may not have a functional issue, but there's already a structural issue there. So it can be a pointer that this person can have CKD later in life or at that point. So pregnancy is also a risk factor.
Yeah. So I'm so a lot of women will be afraid right now. You telling them that pregnancy is a risk factor.
But it is what it is.
It is what it is. I've been pregnant a few times and I'm still here.
Yeah.
But so, I said most times, typically, the hydronephrosis will reverse after some time.
Yeah, doctor, in your experience and expertise, has there been cases of asymptomatic kidney issues where the patient probably doesn't know that he has kidney issues until it progresses to a very late stage? Has there been any issues?
I would say no. I will attribute it to the fact that people are unaware of what they should look out for.
Okay.
I will attribute it to that, not that it should be asymptomatic till the end. You must have had a little sign. Maybe you didn't
pay attention.
Exactly, and you didn't feel it's important, and I will tag it to ignorance or not being aware of the things you should look out for.
Okay.
Okay, so now I would like to ask, because of course there should be a way to prevent these things. What are the lifestyle, what are the things I should do, to prevent myself from getting to this point? And for the fact that the stage 1, 2, 3 are quite, mild, not, okay, 1, 2, I think, are mild, they are not as dangerous as the 3, where it now becomes much more obvious. What are the things I can do to prevent myself from getting infected?
So, one of the things that we should do, like I said, in worldwide, the commonest cause is diabetes.
Yes.
And a lot of people in our environment have diabetes. So, by the time you're having diabetes 10 years from the time you began, you're already at risk of having chronic kidney disease. So the aim at that point, or before that point, is pure glycemic control.
Control your sugar.
Control your sugar. If you're giving medications, because there are some people that will go and be taking bitter leaf, okaze, and the rest of it. Good and fine. I don't know. But the aim should be control your blood glucose. Whatever drugs that were given to you in the hospital, take it and maintain a good glycemic control. Then for hypertension, take your medications. A lot of our people, they take their BP medication today, then they will check if it's elevated the next day, or if it's not elevated, they will not take and leave it for 1 week. Please take your antihypertensives. Another point is that, like I said, sore throats. If you have sore throats, kindly go to hospital, treat it with a good antibiotics, treat infections. Then your salt intake should be minimal. Salt. Minimize your salt intake. There are some things that, the thing about kidney disease is that there are some things that you can't modify.
What does that mean?
The risk factors, there are some that you can modify. There's some you cannot modify. And I'm telling you the ones that you can modify. If you're big, please. Obesity has been implicated. So the ones that you cannot modify, you cannot change the fact that you are black. Because studies have shown that black people are more at risk to having CKD. So you cannot change the fact that you're black. Males too, you are more at risk of having CKD. You cannot change the fact that you are male. Even if you go and change your gender, no, you are genetically male, so you are predisposed, right?
Biological male.
So there are some, like this autoimmune thing, your body, you can't control it. The body just does what it does. So the ones that you can, the obesity, hypertension, infection, even those that are already diagnosed with HIV, and they are saying it's not my portion. Start your antiretroviral and keep at it. It will help a long way.
Thank you very much, Dr. Ifeoma Hope. We've been discussing extensively about the human kidney health, and we've had no other person than Dr. Ifeoma in the studio with us to discuss this. Thank you very much, Dr. Ifeoma. Thank you for coming and educating us and the viewer, of course.
Thank you so much.
So, dear listeners, shortly we're going to be giving you updates on the current situation happening in the country concerning the hunger and hardship protest. Please stay tuned. We'll see you after the break.
See you soon.